Prostate cancer is an enemy.
Hello, welcome to Men's Health Matters, and I'm Floyd Willis, a primary care physician at Mayo Clinic in Florida and a member of the eye care team. We're here to introduce you to Quincy Wimberly. He is going to talk about the exciting work that he has going on in our project with eye care, and I will turn it over to Quincy and have him introduce himself and tell us a little bit about his role.
So hello everyone, I'm Quincy Wimberly. I'm a current program coordinator in Dr. Odedna's lab at Mayo Clinic. Kind of matriculed into this line of work and here today through my background in public health. I have a bachelor's in public health and a master's in health informatics. Did a lot of community work, working with the state of Florida, doing some nonprofit work, and now it kind of led me here today with research, working in research currently up under Dr. Odedna's lab and facilitating her project.
I think that's fantastic. Quincy, tell us a little bit more about the project and the collab and what your sort of goals and objectives are for the project.
So the current project I work on is currently called Community Learning Lab. So it stands for CoLab. It works primarily with the American Legion Post, and it aims to address prostate cancer disparities, education, and those aspects of the social determinants of health to empower our men. So this is a clinical trial that is currently going on with, it has 4 American Legion Posts involved, St. Johns County, St. Augustine area. We have 2 in the Jacksonville, Florida area, as well as 1 in DeLand, Florida, as our comparison site.
So it's really interesting. Community Learning Lab. I would love for you to tell us all a little bit more about that whole concept, because when most of us think of lab, I'm a practicing physician. When I think of lab, I think of some test tubes and some samples and white coats. But that's not really what we're describing when we say lab here. Can you tell us a little bit more about the learning lab and the whole concept?
So it is a very interesting approach. So what we mean by lab, we aim to utilize this space in the American Legion Post. It housed a lot of our veteran personnel, veteran staff, the veteran community at large. So we're targeting Black communities that have American Legion Posts directly embedded in their communities. And from there, we establish a connection, a partnership, an engagement. And we develop a multitude of programs and services that is up under the CoLab kind of technical umbrella. It involves prostate cancer support groups, prostate cancer book clubs, computer technological interactions. So where we have computers housed that the men that's participating in the CoLab study that they can utilize to educate themselves and inform themselves. And we measure it in the quote-unquote lab through surveys. So it's no test tubes involved, there's no shots or anything regarding prostate cancer knowledge or information. It is strictly through interactive approach through informational brochures, prostate cancer literature, and as well as understanding what is the cognitive idea around prostate cancer from the current man in the study.
I think that's very interesting, just to know that you can take the lab out of the building and bring it to the community. Why do you think it's important to have that lab in the community, or maybe not in a building someplace with glass doors and passwords? What advantages does that give us? In your opinion?
I can speak a little to that. In my opinion, per se, just from looking at the historical and cultural aspect with the relationship with Black men and interacting with our hospital system, it's not, quite frankly, the best per se. It lacks somewhat trust. So to reestablish trust, the study is so great because we have Mayo Clinic staff, such as me, on site facilitating the educational aspect of healthcare related to prostate cancer. So it is very impactful, and I believe additional programs through other corporations should consider this approach of interacting with community members directly in the community, because sometimes outside of the trust, there is transportation issues
Right.
with certain communities. So understanding the layout of the land per se, understanding what is the representation that you're having in your patients or participants, things of that nature, you can kind of curate an interactive approach that advances the cognitive knowledge on spaces on anything, not just prostate cancer, and we aim to see if there is some benefit of this program.
True.
Yeah.
Do you have, can you give us like an example of one of the studies or one of the things, or maybe your favorite, or maybe the one that you think is most impactful, just something that's being investigated?
Yeah. Yeah. So I can kind of speak to that, but I'll bring it back to the first kind of point of contact with the men. So to get involved within the collab study, you have to be a part of the recruitment process at the American Legion Post. So the commanders, the advisory boards, we have a community kind of leader aspect and our community health workers involved.
Mm-hmm.
So they're all kind of curate the conversation around it when you have Mayo Clinic staff as well. So there's a recruitment process, and to be a part of the study, there is a survey.
Okay.
So it's a kind of a somewhat of a lengthy questionnaire survey, but it is digestible and readable. It's not above a high school reading level. We try to make it to where everyone could have the ability to read. So after that, they take the survey, and then from there, they get to participate in the programs. And from there, after participating in the programs, they take another survey so we can measure if this implemented program or service impacts their prostate cancer knowledge.
Mm-hmm.
So one program that's currently going on that the Black men are loving and participating in at each American Legion Post is the Prostate Cancer Book Club. So Prostate Cancer Book Club, we're reviewing the book from Mayo Clinic, Prostate Cancer, Mayo Prostate Health, 3rd edition. We're reviewing that constantly, going over chapters 1, 2, 3, and 4, the whole entire book. We're currently on chapters 3 and 4, and just to hear the men's responses to some of the questions that they may have, or some of the things that they didn't know that they're learning now regarding like PSA level, regarding point of diagnosis, treatment options. It is very interesting to learn and to be a part of. So that's
a great example. Have there been any challenges or anything that sticks out in your mind that says, no, this was the thing that made it difficult, or this was the tough part of getting it going? I mean, maybe you say everything was smooth sailing, but if there's anything that sticks out that just for those people that might say, wow, that's a cool thing, maybe I want to do it in my community. But what are your thoughts? What's the biggest barrier?
Yeah, I believe the toughest part, bundle of things. So the toughest part, one of the things is geographic location. And recruiting, or not recruiting, but informing the public that this program is going on. Those are some of the most difficult part, because each community that we're going into, we have American Legion Post at 4 different locations. They're not the same. They all have different kind of relationships with the American Legion Post. One is maybe utilized as the community center already, and one has maybe never been really used before. So we have to start from ground level up approach and kind of waning the men in to kind of be in the part of this kind of atmosphere to even talk about prostate cancer. So we have to cultivate that and dismantle all of the cognitive issues or barriers that they may have regarding healthcare knowledge. Cognitively have a conversation about it in a critical way. So that's kind of been the most kind of barrier part. But through the extensive amount of the study and interacting with the commanders and me kind of being the prime coordinator, it has been kind of on an incline due to some of the incentives that we offer. So if you participate in our study and do the survey, you get a $20 gift card. So every time you get a $20 Clin card, and that's kind of like the gateway of like, I'll see what it's about. And then once they get in, we kind of not overload, but give them a lot of information to look forward to in programs.
I think that's fantastic. So you say it's on the way up. Any other specific things that you do to keep it on the way up, or is there any anything that you're thinking of to try to get it to spread beyond what it is right now? And I know this might be early,
Yeah.
but any thoughts along those lines?
Yeah. So the way to do that has been worked on for the collab study right now is the relationship with the management, I would say. So relationship with the commanders of the post, the relationship with the community health workers I mentioned they are part of our study. Having key personnel that are community members, vocal community members in the community that people are listening to. So that's kind of the way to have constant re-engagement, and we aim to have consistent activities or services at least once a month at each site. So that kind of facilitates that interaction. The men may come on their own to the post, and then the second time they come during the month, they might participate in a program like a book club, a support group session, computer access, or we have maybe a healthcare professional such as a doctor or Dr. Wiz, you may come yourself to the American Legion Post and do a presentation. And that facilitates the kind of current engagement, and the voices of these community members, they yearn for it, they love it, and they want it consistently all the time after they get involved.
So many people in the audience might not know what a community health worker is.
Yes.
I really am a big supporter of that whole concept, but can you tell the audience what a community health worker is, why they're helping you, and why they might be beneficial to the community?
Yeah. So in hindsight, in the smallest version of it, the community health worker is a part of the collab study. They act as the conduit between the community and the American Legion Post. So the right now the community health workers are actively engaging with the collab participants, inform them that they have new brochures on site, new programs that they can offer, always calling and reinforcing that, hey, be sure to come back to the American Legion Post. We have Quincy on site next Saturday to answer any of your questions, answer any of your questions about the next time we're doing a survey assessment. How are you doing? Let's facilitate that conversation. So they're very vital in after we getting the men into the American Legion Post, they leave. So we can't control that. But the way we're trying to actively control that is through the community health workers and their relationship with the post.
And they are the community health workers, people from the community. And and the second part of that question, do they call or contact people way outside of the community or just right around the post?
Yeah. So the community health workers are directly from the community. So some of these participants, they know them by name. They said, hey, I know Mr. Dr. Willis down the street. I think he'll be great to come to this conversation. And they'll give him a call and say, hey, come to the post. And they get signed up to be a part of the collab study. The second question that you asked me was pertaining to...
No, that was the question. I asked you, the second part of the question was, do they call just the people in the community, or can they call somebody across town if they know them? But I think you answered it.
They can call someone across town, per se. However, geographic-wise, we're aiming for the Black men target area. So if we're at an American Legion Post already embedded in the Black community, they probably will be making calls in that circumference area.
Okay.
But anybody could be a part as long as they're
come through your door, right?
Yeah, in Jacksonville, and come through the American Legion Post.
Another question is, how do you know that it's working? How do you measure what's going well and what's not?
Yes. So right now, it's kind of a multiple things, but the primary thing is the questionnaire survey that we're doing. That's basically how we get the feedback. How we kind of obtain the knowledge of like, okay, this is working. So on the questionnaire, we survey them every 4 months from the start of them interacting with the collab study. And after that, it's up to the program coordinator as to continuously do field notes. We do other ways, community health worker conversations. I have scheduled times with them, and as well as meeting with the commanders. So I meet with them on a weekly basis every Wednesday to kind of facilitate how programs are doing, because I can't be at every place at one time. and just obtaining feedback from the participants while I'm on site.
Oof.
So that kind of dictates how the programs are going, or hey, this computer information, we don't know what this is, and I make adjustments from there.
Are there other community partners that work with you and Mayo? Who else in the community sort of help things along? It sounds like the post is probably the most important, but
the post is the most important, but we are leveraging some of their relationships they may have already.
okay.
So the collab study is perfect because the American Legion posters already have a lot of footprints going in and out of it consistently. Whether it might be for a birthday party. I was one time doing a book club session at American Legion Post 197. There's a wedding going on. So they have a lot of footprints going in and out of the post. So they have actively relationships with different partners that we can leverage to if they're within the program scope, empower the men that way. We target around 200 to 50 men to be a part of the study.
Okay. Perfect. So the post is probably the biggest partner. Why are they the most important partner? Anything you can share with us about why they're so helpful?
Yeah, I would just go back to the relationship they have in the community. It's different from anything that I have seen before versus the local community center to the barbershops or simple community parks. Military veterans are commonly found at the American Legion Post because that's where they go to be a part of program services afterwards, after their time in service in the military. So that has kind of been the prime gateway to meeting people, meeting the Black men where they are, and getting as much men involved as possible.
Right. Yes. So maybe to give the audience a little bit more insight on your role, what would be your typical day?
Typical
at the
day.
Post.
Yeah.
I mean, any Wednesday or Tuesday afternoon, you get up and you go to the Post, or are you meeting with a partner, or are you looking at data, or what?
Yeah. So I mean, you're hitting it right on the head, Dr. Lewis. So the typical day for me would be wake up, I go down to our Mayo Clinic Community Health Collaborative site downtown. So Mayo Clinic has a new location, fairly new location downtown that's directly in the community that me and the eye care team currently works under Dr. Adena's lab. I will check in there first. I will review data. I might do vendor payments. I might do clinic card loading of the $20 gift card for the men participating in our study. I review the data of the men. I facilitate the programs that's currently being established. So I have to make sure they have enough brochures, pamphlets, things of that nature. I have to make sure the computers are ordered. I have to make sure the men are being followed up with by the community health workers. So I have to do constant calls with them, ensuring that they're involved. I may do a touch point with our collab evaluators because we have evaluators on the study. They just wanted to measure how successful the project is going. And then I may get frequent calls from commanders saying how their week has been going or something they wanted to go over with me. And then I probably would take the little bit of half of the hour at the end of the day for writing field notes for me and how the day was and preparing for the next meeting the next day.
Right.
Yeah.
That sounds fascinating.
Yeah.
It really sounds encouraging, and I probably have said somewhere along the way to you that I've practiced for a long time, and it's just really exciting to me to see you and your team out in the community, giving people knowledge that maybe will keep them out of my office.
Right.
Find something early, prevent something. Because I've seen you and your team and eye care work enough to know that I know a lot of it is prostate cancer, but I know a lot of other good healthcare information.
Yes.
It's given
It is.
along the way as well. Good healthy tips, that kind of thing.
Correctly.
I know we're probably at a point we need to wrap up, but I would love to give you the opportunity to say, hey, here's what I would want the audience to take away, or here's the message I want to give to them about the whole collab process. So any way you want to summarize things, or just leave us with whatever your best, most important thoughts are.
Yeah. So currently, right now, in regards to the collab study, if anyone would want to replicate this, you have to know the personnel or identify who would you want to work with, because that makes this program all kind of work and function. I'm just one person in this whole circle and triangle and square,
Sure.
this whole shebang that we're doing with the collab study. I may be the prime contact for the study. However, the commanders, the community health workers, the additional members on our staff, such as the research project assistants, they really all make the project work so that when we get in front of the men to sign them up, to recruit them, it's a seamless process. So number one, we have to identify who we want to work with and what community that we're targeting. And that makes a difference regarding prostate cancer knowledge and education. And we need more programs such as this.
Mm-hmm.
So I really enjoy it. I've been fortunate enough to work in this program for about 9 months now. So I'm fairly new, but I've enjoyed every second of it.
Mm-hmm.
And to witness the light bulb turn on in Black men's head too about prostate cancer diagnosis, treatments, or simply PSA levels, it's enlightening and something that I personally will take back to my family. So, yeah.
Thank you very much, Mr. Quincy Wimberly. And I'm Floyd Willis. This is another episode of Men's Health Matters.
Prostate cancer is an enemy, killing many, many men with no mercy.